Hi, I'm Dr. Matthew Pearson. I'm a pediatric neurosurgeon. I was born and raised in Houston, Texas. I went to college in San Antonio, so I'm Texas born and raised. I went up to Maryland for medical school and then did my neurosurgery training in Nashville, Tennessee at Vanderbilt. I went back to Texas for my pediatric neurosurgery fellowship, went back to Vanderbilt where I was on faculty there for the next 10 years. I then went down to the Gulf Coast in Pensacola, Florida, practiced there for the last 7 years. But Greenville called, and I came up to join my new partners at Prisma. I got into pediatric neurosurgery because, first of all, I love working with kids. I've worked with kids since college when I was a substitute school teacher. Kids are great. They don't want to be sick. They just want to get better. They just want to go on with their lives. And I want to be here to try to help them. From a neurosurgery standpoint, dealing with the brain, the nervous system, basically everything that makes you go. Really, can you name me 5 more cool jobs in the world than pediatric neurosurgery? It's a privilege to be able to be part of this field. Kids bring life, kids bring energy, and that's why I want to come back and see them every day. In pediatric neurosurgery, probably my 3 specialties would be care of brain tumors, epilepsy, and movement disorders. Cerebral palsy, you may have heard of. Those are 3 words really frightening to parents. And it's something that we really can help them, and we can help the kids feel better, do better, and live longer with what we have to offer them. My style of practice is focused on the child. The kid is the guest of honor. And I involve the child in all our discussions from the very beginning. What attracted me to Prisma is the team that I'm coming to join. All the leadership, all the hospital structure is all about physicians and caregivers. And that changes the focus of the entire health system when we have a total team of people totally focused on the child, on the patient. And that is an exciting group to be part of. In my daily life, I'm an audiophile. I have a stereo system set up with tubes and a record player. I listen to music of all kinds. But what's most unique, I think, is that my wife and I have spent the last few decades breeding and showing Persian cats. We've traveled the country showing cats at cat shows. Yes, they do exist. And we've met people from all walks of life, and I have friends from coast to coast in all aspects. And that's a wonderful expansion upon what can often be a very focused life in the hospital. In working with kids with brain tumors, with epilepsy, with cerebral palsy. Again, those are frightening just words to use to parents. And it's natural to jump ahead and say, what is the long term? Where will we end up? And what I advise them is to realize that this is a step-by-step process. We often don't know the details up front, and we have to answer each question each step at a time before we wander down pathways that don't exist. Let's focus one step at a time, and that's how we'll help our child down this path, all of us on the team together. If you'd like to make an appointment with me, you can do so by calling the number on this webpage.